Hello, my name is Ms. Blackledge, and the video you will be watching is on correct blood pressure measurement. However, I wanted to cover a few things. First of all, I have included a PowerPoint presentation that goes along with the video, so you don't have to take notes. However, during class time, come prepared to discuss the video. After the discussion, there will be a demonstration how to take a blood pressure reading and verbal explanations. Next, there will be a skill practice time, peer instruction, and return demonstration. We will finish with a short post-conference. That is all for the classroom explanations and updates. The video begins shortly. Thank you. Hello, my name is Ivana Blackledge, and this presentation is how to take a correct blood pressure measurement. I will start with an introduction on hypertension in order for you to know how critical it is to take an accurate blood pressure reading. The objectives for the presentation are, after watching the presentation, the learner will know why hypertension is known as the silent killer and what the risk factors are for hypertension. 2, after watching the presentation, the learner will know and demonstrate how to take a blood pressure reading. 3, after watching the presentation, the learner will know how to teach their peer how to take a blood pressure reading. 4, after watching the presentation, the learner will know how to assess the blood pressure reading. Hypertension is a major risk factor for heart attack, stroke, and death. It is called the silent killer because many people do not know they have hypertension. It is the leading cause of death from cardiovascular disease in America. 1 billion people have hypertension in the world. 79 million people have hypertension in America. But when healthy lifestyles are started early, they can reduce the risk of hypertension or even prevent it. Lifestyle modifications include weight reduction, DASH diet, sodium reduction, exercise, moderation of alcohol, and stop smoke. That is why it is so important to catch blood pressure early, high blood pressure early. Accurate blood pressure measurement is critical for doctors to diagnose, titrate medications, and make medical decisions based on the reading. The definition of hypertension is defined as systolic blood pressure greater than 140 or diastolic blood
Diastolic
pressure
over
90.
90.
Or if anyone is taking hypertension medications, they have hypertension. Diagnosis is made after 2 readings on separate occasions after an initial visit to the doctor. Blood pressure classification was made when JNC7, which is the resource we use for blood pressure and management of blood pressure, that was published in 2003, and JNC8 came out last year. They made it more stringent, and now 120 to 139 and 80 to 89 is now considered to be pre-hypertension, and patients are at increased risk for progression to hypertension. So lifestyle modifications are encouraged for those patients now. Patients with 130 to 139 or diastolic of 80 to 89 are twice the risk for hypertension. The equipment you will need is a sphygmomanometer, which is right here, and a cuff, plus a stethoscope, an alcohol wipe, and a paper and pen for documentation. Assessment. You will start with your assessment. Site selection. Avoid any shunts or fistula sites. Avoid a mastectomy on that side of the body and any axillary surgery. Avoid any traumatized limb or heavy bandages. Also, determine what the patient's baseline blood pressure is. Determine if the patient has a latex allergy, and if so, they've had a blood pressure taken before. Next, we go to planning. A correct size is one of the most important factors that can influence the accuracy of a blood pressure reading. Most adults require a large cup, and once it is put on, there should be at least 2 fingers that fit underneath before you inflate it. Studies have shown, evidence-based practice, that the upper arm is used. And for obese patients, a study was done for perioperative patients that if you can't get a cuff, you can use the forearm and use the radial artery at the heart level and document the site when you take the blood pressure there. You selected the appropriate cuff, make sure the equipment is in the room is warm, quiet, and relaxing. You expose the extremity, remove constricting clothes, and you perform the hand hygiene. Okay, so now we are ready to take our blood pressure, and we'll ask our patient, Mr. David, to come up and have a seat. How are you?
Good.
Is there a particular arm of the doctor or nurse to take your blood pressure?
Usually my right arm.
Okay. So we position the arm with the palm up. We expose the extremity. We palpate the brachial pulse. With the cuff deflated, valve open, we place the cuff, the artery right over the palpation. Usually 1 centimeter above, 2 centimeters above or 1 inch above the pulse. The gauge needs to be at eye level. Now we place the stethoscope in our ears, locate the brachial artery, we put the diaphragm or a valve if you have a valve, whichever one you prefer, it doesn't make a difference. We close the valve, and we will, Mr. Blackwood, what is your blood pressure, systolic blood pressure normal?
It's usually around 115 over 75.
So we will pump up to 120, we will pump it up to 150 to 160. If we did not know the blood pressure, we would pump up to 180 to 200. But since we know the blood pressure, we'll only go to 160, so not to squeeze too hard. And we'll watch the gauge go up. So we're at 160, and I'll release the valve, and we'll watch it slowly go down at 2 millimeters of mercury, 2 millimeters per second. Okay, I heard it at 120, the first sound, and now we'll wait until we don't hear any sound. And now it's over 80. And then we just let it go down. Okay, that was a very good blood pressure. Very good blood pressure, 120 over 80. Okay, thank you.
Thank you.
Make the patient comfortable. Okay, so by telling the patient their blood pressure, it promotes participation in care and understanding of the health status. Also, makes the patient accountable for follow-up assessments. At this point, we will perform our hand hygiene, clean the earpieces with an alcohol wipe and a diaphragm. If this is the patient's the first time, we would take blood pressure in both arms. Normally the difference is 5 to 10 millimeters of mercury. If there was a higher difference, then there would be some vascular problem, and we would tell the health provider that. And so this would establish a baseline, and then we would see if it's in an acceptable range and document that. If the blood pressure was above acceptable range, we would repeat it in the other extremity and compare the findings. We would observe for related symptoms. Is the patient having a headache, flushing, nosebleed? If there's fatigue in the older adult, we would report that to the nurse or the healthcare provider. We would administer antihypertensive medications. Now, if the blood pressure was not sufficient for adequate perfusion and oxygenation, for example, maybe 90/60, but some patients can tolerate that. I walk with a blood pressure of 90/60. That's normal for me. But some patients would feel weak at that point. So we would place the patient in a supine position and assess for signs and symptoms of hypertension. They might be dizzy, they might be confused, a weak, thready pulse. We would assess the factors of why that patient is having low blood pressure. Maybe there's hemorrhage, there's hyperthermia, and maybe anesthesia, or it's a side effect of a medication that they're taking. We would report that to the provider or a nurse in charge, and we would increase their IV rate and infusion rate. And at that point, we would record the blood pressure and the site that it was taken, and tell the patient their blood pressure reading. And that brings us to our patient and family teaching. For teaching, if it's pertinent to the patient, we would go over the risk for hypertension. For example, a family history of hypertension, if the patient has premature heart disease, if they have lipidemia or renal disease, obesity, smoking, heavy alcohol use, high blood cholesterol and triglycerides, continued exposure to stress from psychosocial and environmental conditions are factors that are linked to hypertension. Primary prevention for hypertension would be lifestyle modifications to lose weight, exercise daily, reduce sodium and saturated fat, and maintain adequate intake of dietary potassium and calcium. Cigarette smoking is a significant factor and risk factor so encourage patients to stop smoking. And we would tell the patient their next appointment. We would encourage lifestyle modifications. We would go over their medications, and we would print the information so they can take it home to read at their leisure, because of course they're not going to remember everything we just went over, and it's for reinforcement also. Thank you for watching the video, and